Pauline Watts, welcome to the University of Huddersfield.
Thank you.
You were here for a special event organised by the Community Practitioners and Health Visitors Association, a question time for our health visitor students. There were lots of issues discussed today. One of the ones, the concerns perhaps by the students, was this change that's going to take place. That is the commissioning by local authorities for health visiting, as opposed to, as it is now, by the government. What was said to them? Is this going to be a dramatic change? Is it going to be as scary as it sounds, or will it all come through?
Right. It was raised by the students, and I think I want to start by saying it's not going to be the major change that people are anticipating. There's always a fear in change that everything will change, but commissioners have changed over the years multiple times, and it's literally who is just commissioning the service. People's employment will stay the same and the essence of their job will remain the same. The transition of commissioning in 2015 is being well planned. And I told the students today that we're doing lots of work already with Local Government Association, with NHS England, Health Education England, and aligned with the Department of Health to make sure that we're getting ready for that transfer, for that transition, to make sure that the service is understood, what it can deliver is understood, and that we are beginning to do some shared commissioning in advance of the handover of the transfer. Another thing that I told the students was the importance is that if you think of it as an opportunity, there is an opportunity in going to the local government in that they have an interest in their communities. And health visiting is about working with communities on public health issues, it's about the population's needs, and very much the local authorities have a real focus not only on the population's health but also for looking after children aged 0 to 5. And the health visitors will have more partners and more links that will enable them to improve on those outcomes for those families and children.
Is health visiting changing? Is it going, not just in terms of this transition between from the government to local authorities, but is it changing as a profession? Is it growing? Is there more emphasis needed on it?
In some ways the answer is yes, and in some ways the answer is no. Some of the core factors of health visiting, some of the unique aspects of health visiting and the training will always remain the same. There will always be population needs, public health needs, prevention needs, in which case the underpinning training remains the same. What is changing about the profession is that health visitors are moving more with the evidence base changing and the importance of the baby's brain and the young child's brain. So they'll be doing lots of work with families during pregnancy and in the first 2 years of life to ensure that they are working on positive parenting, making sure that they're understanding issues of attachment, making sure that they're working with mums on mental health and well-being, and working with partners during those first 2 years to get the environment right for the child. So lots more behaviour change, lots more motivational work with families, and working to make sure that we have strong and stable families that enable the children to be strong and resilient in older life, and that right through the life course that they have better health outcomes.
So the future sounds rosy, which is very positive for the students. I know one of the concerns of healthcare students across the country is that they're training, but there may not be jobs at the end of it. Will there be jobs for health visitors?
The government has made a commitment to 4,200 extra health visitors in the service by 2015. Mapping was done from the start of the programme and continues to be monitored by government. It's a high priority for ministers and it has scrutiny by Cabinet Office. So we have mapped the number of students that we need against the number of jobs that will be needed in the system, and we are monitoring that on a monthly basis to make sure that the jobs match the number of students that will be coming out and the number of vacancies to improve and increase that number to 4,200 extra. What we do have is a situation where perhaps there may be students who have trained in one university and they may have to move maybe a little bit or travel a little way from where their home is to secure a health visiting post, because there are different needs in different areas in the country. But we have done a lot of work previously when people have been worried about not getting a job to work with that student, and we've secured employment. We are committed to finding employment for all health visiting students, and should we reach a situation where there is oversupply for the jobs that are out there, we are very much doing planning for how we engage the workforce for employment, so that when there is natural attrition, that we can actually use that oversupply to be ready for when there is a reduction in numbers through natural attrition in the service.
The University of Huddersfield, inspiring tomorrow's professionals.